We would like to welcome to the program Dr. Michelle Fiscus, who is a pediatrician in the Cool Springs area. Thank you so much for being here.
Thank you for the opportunity.
Yes, and so nice to talk with you. We're going to be talking, by the way, about obesity and overweight children. If this is something that pertains to you or you'd like more information about it, this is a segment you definitely want to watch. If you wouldn't mind, Dr. Fiscus, just explain, I guess, the difference, first of all, because there is a difference between obesity and overweight children.
That's right. There is a difference between obesity and overweight. And I think it's very important for parents to understand that it's really a clinical determination and not a judgment call on the part of their child's physician. So there's something called a body mass index, which is or the BMI that people might hear about. And that takes into account a child's sex and how old they are and their height and their weight. And then there's a calculation that's done to determine the body mass index based on that data. And then that body mass index is plotted on a chart that shows us what normals look like for those different ages. So an 8-year-old girl is going to be plotted against another 8-year-old girl. If that child's body mass index is greater than the 85th percentile, then that's considered overweight. And if it's over the 95th percentile, then that's considered obese. So it's a measure that we use, much like people use a blood pressure measurement. If your blood pressure is over a certain number, that's considered high blood pressure. If your BMI is over a certain number, that's considered either overweight or obese, depending.
There's been so much talk in the last several years about children, you don't want them to become obese. You don't want them to become overweight. There's things that you can do to prevent that from happening, regardless of a family history or that kind of thing. So as you said, it's a clinical diagnosis, but it's also become a serious situation. We should also mention, are the president for the Tennessee chapter of the American Academy of Pediatrics. So you see things from a statewide perspective as well. Can you give us an idea of where Tennessee ranks when we're talking about obese children?
Well, the South in general ranks very high on the obesity prevalence scale. So when you look at the country altogether, southeastern states tend to be more obese than the rest of the country. Tennessee is currently 4th as the most obese state. So we rank under West Virginia, Mississippi, and Alabama, but we're number 4. That's really looking at adult numbers more than children. About 1 in 3 Tennessee adults is considered, it plots out as being obese on the BMI charts. For children, it's less than that. And that number's actually improved for young children, which means that we're starting to move that needle in the right direction for this next generation, which is very important.
Absolutely.
We spend an awful lot of our time trying to prevent adult disease by raising children in the healthiest way that we can and helping their parents do that. And so, so some of the efforts that we've made across the country through American Academy of Pediatrics and other places has helped to kind of move that the right way.
You know, when we talk about children, just in generalities, I think people probably tend to think of that 8-year-old girl that you had mentioned. But when we're talking about obesity or just even overweight issues, it can happen in children as young as 3 or 4. I mean, toddlers.
Right, and even younger than that in some cases. I've had personally some extremely obese 9-month-olds in my office. And a lot of that comes down to dietary choices that are being made. We know that there's some data to suggest that early breastfeeding might help for an older child to make better choices in the foods that they choose. More water, less sugar-sweetened beverages, more fruits and vegetables in their diet if they have a history of breastfeeding. So breastfeeding can have a positive impact. But there's so many different issues. Your zip code. Do you have access to fresh fruits and vegetables on a regular basis? If the fastest place for you to get a meal is a fast food restaurant with a $99 or 99-cent hamburger, then you're much more likely to eat there. So socioeconomic situation, zip code, whether or not your parents are obese, whether or not you're home with your parents versus maybe in a daycare center. There's so many factors that lead into adult obesity that we're trying to regulate the best we can.
Sure. And as you said, it starts off when they're very young. Something that I know some parents as of late have tried to do is, grow the vegetables in your backyard or do something that the child can actually see and be a part of, take them grocery shopping, just expose them as much as you can to the fruits and vegetables and whole grains and things that are good. Would you recommend that, as being a pediatrician, is that something that you would suggest to, the parents of a patient who might be struggling with something
absolutely.
like this?
If you can grow it at home, that's fantastic. When you take your children to the grocery store, you want to try to stay around the outside of the grocery store and not on the inner aisles where the more processed foods are. And then, fruits and vegetables don't get targeted during television programs. sugar sweetened beverages do, sugar cereals do. So watching, even screen time for children can impact how they eat and the choices that they make as they get older.
Yes, and being outside is very important too, being active. Can you talk a little bit about even implementing exercise at a very young age and the importance of that?
Absolutely. At least an hour a day. That would be the best thing for us to see, is an hour a day of physical activity. It's difficult to do. Parents work, kids are in school. There's always threats to physical education in the school systems, and so keeping that in is extremely important. But trying to get kids outside as much as we can, and finding ways to disconnect them from internet and video games and screen time, and get them out and moving is always going to be a beneficial thing.
We have to keep in mind there are long-term possible complications, health complications, if you don't curb this issue early on.
Right. Yeah, so a lot of the things that we see are early type 2 diabetes, which when I was in training a long time ago, we never saw type 2 diabetes in young children, and now unfortunately we do, and that's all weight related. We see early high blood pressure in children because of their weight. We'll see joint problems, and not to mention also the social and psychological impact that being an obese child can have on your relationships in school, your ability to participate in sports, and the like.
Also, there's some other things that parents probably should consider. This time of year when the kids are more indoors, and we're talking winter, even early spring, what are some things that parents should keep in mind?
Right, so hand washing is critically important. If your child has a fever over 101, they really shouldn't be attending school. Most of these early colds and flus that we see are transmitted through respiratory secretions. That's basically sneezing and coughs and snot. So encouraging your children to wash their hands after they blow their nose or wipe their nose, making sure they're covering their coughs. Soap and water is always better than hand sanitizers. If you can get that in too, that would be great. But definitely if they have a fever, they need to be home.
Yes, and a lot of doctors' offices nowadays have the triage nurse, somebody available who can kind of consult, somebody who might be having some issues at home.
That's right. Any office will have a nurse that will speak to the patients about whether or not they need to come in. Most pediatric offices will have the ability to see a child the day that they're sick, or at least within a day or two, depending on what's going on with that particular child. So they should always call their own doctor first.
All right. If somebody is looking for a new pediatrician, what is one of the main things they should think about? If you can offer up some advice with that.
Ask your neighbors.
Okay.
Ask your preschool or your school nurse and see who they've worked with and who they've liked. And then call that office and set up a time to go in and talk to that pediatrician. Most pediatricians will sit down with someone free of charge and get to know them so that they can help them make that best choice.
All right. Pediatrician Dr. Michelle Fiscus, thank you for your time today. You gave us excellent information, a lot of great recommendations. Thank you.
Thank you.